So, Dr. Akan, what is HIV/AIDS?
Thank you, Toju. AIDS is acquired, stands as an acronym, it stands for Acquired Immune Deficiency Syndrome, and it's a disease caused by a virus called HIV, which is another acronym for Human Immunodeficiency Virus. So this virus causes disease, and how it does it is that it attacks the immune system of the body. The immune system is, what keeps away disease, infections, etc. And so once there is, insult to the immune system, it kind of paralyzes it and paves way for the infections and even cancers that can occur. So that kind of describes HIV disease, but AIDS, acquired immune deficiency syndrome, is at the end of that spectrum. So it's a chronic disease, is life-threatening, and a very serious one at that.
Okay. So where did this virus come from?
It's thought to have originated from Central and Western Africa, and it's thought to have come from chimpanzees and monkeys. Okay. So there are basically two types of the HIV virus. There's the HIV-1, which is thought to have come from from the Cameroons, so southern Cameroon, and it has been traced to simian immunodeficiency virus. As for HIV-2, it has been traced to Senegal, and it's been thought to come from monkeys. So this really has been between the 19th and 20th century, the late 19th century and the 20th century. Okay. That's about the time that this virus is thought to have come into play, really.
Okay. Who's at risk?
Good question. So it's going to be the guys who are exposed to, blood and blood products, people who get transfusions, people who do tattooing and piercings in the skin that have to come in contact with sharps that have been used on someone else.
Yes.
And then people who are exposed to unprotected sex with multiple partners. And then people who also would have, I talked about blood transfusion, and then of course mothers who have HIV who have not been started on the antiretroviral therapy I told you about could transmit that to the baby. So if a mother is HIV positive and doesn't take, is not put on antiretroviral drugs, there's the risk between 20 to 45% of transmitting that virus to the baby.
What are the signs and symptoms of HIV/AIDS?
I could group that into three broad groups.
Okay.
So there's the acute infection, which usually comes up just shortly after exposure to the virus, but not within 7 days.
Yes, one of the people on the street said within a week.
Within a week, yeah. So a couple of weeks to months, it could have some fever, some headache, some body rash. There could be some swellings appearing transiently in the body, and that could just be cause for concern, but probably just transient, and then the person might be okay, and the person slips down into the phase that we call or refer to as clinical latency. Okay. And this can go on for a variable period of years, really, for some people who don't progress really quickly. But the end of the spectrum really is AIDS, AIDS, that comes with a lot of very horrible diseases and even infections and cancer.
What are the main things we should do for prevention?
Thank you very much. Prevention really would need a lot of political commitment, from the stakeholders to be able to drive and achieve a very high level of awareness within the population about this disease. And so if we were going to have a lot of people knowing their HIV status, and for those who are positive and meet the criteria, getting to be on antiretroviral drugs, this would really go a long way to actually preventing disease. Because as you remember, I said earlier that treatment is a form of prevention. Yes. And then still riding on that wave of political commitment, if we could get our blood and blood products properly screened so that, the viruses are detected in these products and they are not offered to people.
Yes.
This would really go a long way to preventing it. And even driving social awareness about the dangers of tattooing and body piercing, and if all of that could be regulated in a way that it's provided to people in a healthy mode, that would also be a good way of preventing the disease. And of course, also in the same vein, dealing with the myths, some of the myths around HIV transmission, so that people are really clear about how this virus can get into the body and the problems that it can cause. That would also go a long way to preventing this disease. And if we considered that, there's the mother-to-child transmission, that's another area that we should look at really carefully. The World Health Organization fairly recently, has advocated a program called the Option B Plus. And one of the points in that program is offering every woman who is HIV positive and pregnant antiretroviral drugs. So that, if we can achieve that, would actually reduce and even prevent mother-to-child transmission. So in some other parts of Africa, they've advocated male circumcision as a way of also preventing this disease. And by and large, those are some of the ways that we can prevent it. Of course, I left for almost the very last the use of condoms, because condoms have, if used properly, can actually prevent HIV transmission, because in up to 99% of cases, it's very useful in doing just that.